Welcome back to Younger Than Springtime. We have internationally famous plastic surgeon Peter Fodor right from Los Angeles with a home here in Aspen. Peter was nice enough to take off part of his day. He skied this morning, but he's going to teach us a little bit about what's new and exciting in plastic surgery. Peter has a new book out called Be Your Best, which is written for the consumer about plastic surgery. So first of all, Peter, just start with this concept. There's an evolving concept. When you and I trained together back 35 years ago at Columbia St. Luke's, they called them patients. Now they've suddenly evolved into consumers. Tell us about that.
Well, I don't know whether it really evolved into consumers, but people who receive injectables many times are called clients, which I find strange by itself. But there is so much marketing around plastic surgery, and that was one of the main reasons why the book was written, because there are reality television shows that have expanded into plastic surgery, such as Extreme Makeover and a couple of other ones, that in a sense, what they accomplished, they promoted unrealistic expectations in patients. Now patients may come in the office and may say, "Doctor, make me 7 feet tall," because they expect all kind of things. These shows have shown 6. If you're interested, let's say, in blepharoplasty, you go to the blepharoplasty chapter, open up and read about. So that's why it's kind of like an encyclopedia for the potential consumer. Don't know whether that answers your question, but that's where.
It answered it well, Peter, and you hit on a really important subject. As a surgeon myself, I can say unequivocally that the worst thing that you can have between a patient and a physician are a set of unrealistic expectations. And it's hard enough to get a good result when everybody knows what we're trying to accomplish, because the body as a biologic system is unpredictable. And but when someone comes in and wants you to make them look like they're 22 again and they're 72, I think that's a red flag for a plastic surgeon. Talk a little bit about patients' expectations. And someone said to me, I was on the cell phone coming down here telling them that you were nice enough to come on the show today, and they said the worst thing they see in plastic surgery patients, this is another physician, they said, is when you have a 75-year-old and the surgeon tries to make them look like a 25-year-old. What you want to look like is a 55-year-old who just came back from vacation. Talk about that.
Well, that's a very good point. When I look at patients, whether it's rejuvenation like a facelift or eyelids, or changing a nose from a bad nose to a better nose, I look at that patient as a person in their entirety. If they are very youthful in their behavior, in the way they clothe, the dynamic, the energetic, I think they could be good candidates for, let's say, a facelift, because the inner person feels much younger and acts much younger than the outer person looks. And I think in that kind of patient, you get the feeling that you have a good set of expectations. The problem comes, of course, when the patient wants to look 40 years younger, and you say to them, look, we can take off a few years, we can make you look even better than you ever did, but there is a limitation to what we can do. And then the reply comes, well, this sounds all wonderful, but just make me look 40 years younger. And that's the time when you say, thank you very much, but I'm not the right surgeon for you.
Right.